Well, hello. Welcome to Wellness by Design today. I'm Jane Hogan, the wellness engineer. Today, we're going to be talking about lungs and how it's so important to have healthy lungs. They're really the foundation of everything. And I'm really excited to welcome an expert in that
Hmm.
topic, and that's Dr. Rodger Murphy. Free. Welcome, Roger.
Jane, thanks so much for having me here. Thank you so much.
I'm really, really happy to have you here. I know that you're passionate about this topic, and I'm passionate about breath work and how important breathing
Yeah.
is. So we both love this topic. But how did we've all got our own story, right, of how we got into this. And so I want to hear about your story, actually, but I want to tell people about you first. So I'm going to do that first. I almost forgot, but I want to let people know all about you. So, Dr. Rodger Murphree is a board certified chiropractic physician and board certified nutrition specialist. His Murphree method, a combination of functional and orthomolecular medicine, has helped thousands of patients get healthy and feel good again. He's the author of 3 books for patients and doctors, including Heart Disease: What Your Doctor Won't Tell You, Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome, and Treating and Beating Anxiety and Depression with Orthomolecular Medicine. That sounds really high tech. Maybe we'll talk about that. He maintains a busy telephone practice helping patients all over the world get healthy and feel good again. So we're going to learn a little bit more about you, but I do want to hear, Roger, how did you become so passionate about lungs and having healthy lungs?
Well, I've been on numerous summits and I've hosted a few summits and podcasts. I know you have as well. And you so wonderful, so gracious to be on this summit that we're talking about today, sharing your the breath work. But I looked around, my patients that I work with are kind of what I call medical misfit patients. They've kind of been everywhere, tried everything, and they're looking for answers that oftentimes conventional medicine can't solve for them. They can't answer for them.
Yeah.
And just having patients that are looking for a more functional medicine approach, a more finding the underlying causes type approach, that had some lung issues, and there's really just not much out there. You start looking around the different summits and the podcast, you just don't hear many pulmonologists who are trained in functional medicine. And so, what is out there for the most part is conventional medicine recommendations, which is fine. There's certainly a place for that. But growing up with asthma,
Mm.
and then watching my two parents, I lost both my parents to lung diseases. My dad, I lost to lung cancer, small cell lung cancer, and my mom to COPD, um, chronic obstructive pulmonary disease, within 6 months of each other. It was traumatic, and this is something that I have dealt with my whole life with my asthma, have it under control, but it certainly can rear its ugly head. And I felt like there just wasn't enough information out there for people to be able to navigate some of the things that we're seeing right now, in particular with COVID. I mean, with COVID and long hauler that are affecting our lungs, these chronic infections, patients that are walking around, or individuals walking around with upper respiratory infections, seasonal allergies, mast cell activation syndrome, histamine dominance, leaky lungs. I mean, there's just so many conditions out there that need some attention that are not getting it. So here we are.
Well, no wonder you're so passionate about it. I mean, that's devastating to lose both your parents to lung disease in such a short time.
Yeah.
And then also your own story. And I know I see it in people. So many people have seasonal allergies and asthma, just dealing with, I mean, how sad is it to not even be able to get that breath of life that we need as
Yeah.
part of being alive.
Yeah.
And as you said, a lot of people are popping the medications, but they know it's just a band-aid solution. And so people are looking for root causes and solutions to root causes. So how do you even begin to like summarize root causes of lung disease
Well,
or
it's
lung
like
health?
anything in functional medicine, we're really trained in trying to look at what are the underlying causes instead of just treating the symptoms. And again, there's certainly a time and a place for conventional medicine, but conventional medicine is more focused on here's the symptoms. And if we look at the cookbook or the Merck manual, we see if we have all these different symptoms that adds up to this diagnosis. And but with lung conditions, um, just settling for treating the symptoms is not very effective. And if you've ever been around someone, as I have, and personally myself, to see someone struggle to get a breath, it's really an exhausting experience for that individual. And just to see it, it's very troubling to see people who are struggling to get, to breathe in a normal way, and really having a chronic condition like asthma or COPD, or even some of these things like mast cell activation syndrome. And but it's really no different, Jane. The question is, how do you treat the underlying causes? We got to find them. But there's a foundation that you can lay that will oftentimes start to address these underlying issues. And if you think about it, what are the two drivers of poor health? If you think about it, it's stress.
Yeah.
You ask any healthcare professional, he or she's going to tell you that probably 90% of all the illnesses out there are being driven by stress and inflammation. And so if you start there, you start thinking about, what can I do to reduce my stress? Well, breathing. And that's why your presentation was so fantastic, to be able to share how to actually really, to breathe appropriately. And so many people are not, they don't, it's not something that most people are taught, so they don't really know. And then presentations on how to reduce inflammation, how to prevent that. So what's the best diet for you? Is that a carnivore diet? Is that keto diet? Is that paleo diet? Is it whole foods diet? Is it plant-based? So there's pros and cons of these different diets, and we kind of dive into them in the summit. But really, it's about cleaning up the air in your house, trying to detox your house and yourself. So many people are being exposed to mold. It seems like, to me, that's an epidemic. You just see
Right.
so many people now who have mold toxicity issues that I never even would have registered in my brain that, oh, the reason why they got this diffuse achy pain or brain fog or low energy is because they have mold toxins in them, and coming from either their place of work or their home. So there's a lot of material that's shared in the summit that people are going to identify with when they think about the lungs. They think, okay, well, we got these lungs, they work. But if you think about it, the lungs are your window to the outside world. So every time you're taking a breath and taking in this oxygen to support the cells with the oxygen that they need and create the metabolic energy that's driven from breathing, we're exposed to numerous potential toxins and pollution and all sorts of things that can compromise not only our lung function, but can generate inflammation and stressors in the body that can create all sorts of problems.
Mm. Yeah. Okay. So this is your Super Healthy Lungs Summit. You've got coming up October. What are the
October
dates?
17th. Yeah. And then if you can't catch it that week, we do have a replay. So, make sure you get registered for it. It's a free summit. It's free. It's online. And there's 40 speakers. Say there's 42 presentations. I do 2 of those. And then, so there's 40 different health experts. Jane is one of those that are sharing information about, as I mentioned, about how to prevent chronic infections, how to prevent COVID-19, what do you do for long hauler? It's crazy, Jane. I don't know about in your practice, but in my practice, I'm seeing so many folks who were exposed to COVID and maybe tested positive, had no symptoms whatsoever. 3 months later, though, all of a sudden they're starting having brain fog and fatigue and achy pain. It's estimated that 25 to 30% of those who are infected with COVID, whether they have symptoms or not, are going to develop long hauler syndrome, where you have symptoms associated with this infection 3 or more months later that are, continuous. I think we're going to see an explosion of chronic fatigue syndrome. And as you know, that's one of my specialties, fibromyalgia and chronic fatigue syndrome. I think what we're going to see is so many people are going to get a diagnosis of chronic fatigue syndrome. We don't know what else to call it. But when the body turns on itself and starts to generate these autoimmune type of reactions, it can affect just about any system in the body. I've
Right.
got one patient right now who had COVID earlier this year, so January, February, and her kidneys are starting to shut down. Only thing they can think of is that it re-triggered her lupus. And even though her inflammatory markers have been negative for years, all of a sudden we're starting to see that she's having her kidneys shut down, which is, quite serious.
Wow. Yeah. Okay. So this is really valuable work that you're doing, gathering all these experts to help people who are experiencing these different conditions. But it sounds like so much comes back to, as you said, stress, like lifestyle
Yeah.
management, stress, toxins, inflammation in the body. And so, what people are going to learn on this summit is, well, first of all, these different conditions, but also learning how to address some of these root causes or root solutions, even to think of it
Yeah.
that way.
Yeah.
So, really valuable work that you're doing. So, who is this summit for then? Is it for anyone who's just got I shouldn't say just anyone with lung conditions, or is it for other people as well?
It's a pretty broad target. It's targeted at a rather large audience because it could be for a 10-year-old who has asthma. So we have pediatric functional medicine practitioners who are sharing about their go-to protocols for preventing childhood asthma. And then we have presentations for individuals who may be a little bit older who are struggling with some breathing issues like COPD or unfortunately maybe cancer. So we have a cancer specialist on there is talking about functional medicine. Nasha Winters does a fabulous job. And then we have, people that are just struggling with seasonal allergies that they're trying to figure out, what can I do to reverse this curse of seasonal allergies, which can turn into, sinus infections and upper respiratory infections. So it's a rather broad audience. And when you think about lungs, the first thing is, well, I don't really have any problems with my lungs, but once you start to realize that that's the window to the outside world, that's where you're breathing in toxins, pollution, and other things that could be compromising you, maybe not your lung function, but compromising you in other ways, creating chronic inflammation throughout the body. Maybe you don't even know you have mold toxicity. You never even thought about it. But if you have some lingering chronic health conditions that are not responding, maybe it has to do with leaky lungs or mast cell activation syndrome, which is an allergic type of condition. Food allergies can be triggering some of these things. So it's a summit, I think, that if you tune in, you're going to find something that is going to appeal to you. And I know you're going to find something that's going to initiate a aha, one of those aha moments. I'm really excited about having Dr. Eric Gordon, who's sharing information about cell danger theory, which I think is fascinating. And then Dr. Elias shares information on the survival paradox. And they're very similar in that we have these underlying triggers that create these unwanted health conditions. And in functional medicine, as you know, we are looking to find those underlying conditions. However, this was very eye-opening for me in these two interviews, is that sometimes you find the initial trigger, and that's not what's creating the problem anymore. It's actually that the body has gone into the survival mode. The cells have actually gone into a survival mode where they feel they're in danger. And you can do everything right as a functional medicine practitioner, working with these people that normally go, oh yeah, we clean this up. The markers look, the labs look good. They're doing great. And they're still not where they need to be. And it's all about really, okay, what can we do to turn off this self-preservation mode, this defense mode that's gone haywire?
Mhm.
And that comes down to really just cleaning up your diet, getting good night's sleep, um, reducing stress. I mean, some things that I know personally, I've gotten a little jaded to over the years. I like to talk about all the biochemistry and, the micronutrients that you need and hormones and all that. But when you do all those things and you still have not made the progress, then you got to realize, okay, there's something that's causing this body not to turn the right way. It's
Yeah.
continued turning on itself. So I think those two interviews, you don't want to miss those two interviews.
Mm. That's so interesting. And to me, it makes a lot of sense too. In my interview on my summit with Dr. Bruce Lipton, and as you know, probably he's started with stem cell research, and
Yeah.
he talked about how the cells respond to the environment. So if the person is in a very stressed state all the time, and even if they're not aware of it, they're probably got some underlying stresses, then the cells certainly are, they're bathed in that. And so they're going to be reproducing in that environment. And so I can see, does that relate to what these two experts were talking about?
Yeah, absolutely. So, Dr. Elias, he talks about this thing called galactin-3. Now, most of you, I'm sure, never heard of it. You may not have heard of it. I had never heard of it till I read his book. But galactin, you're going to hear a lot about it. And galactin-3 is a chemical that's released anytime the body gets under stress, feels like it's under duress. And it's a normal reaction, just like inflammation. We always have inflammation going on. We're breaking cells down, bone tissue, and then we're regenerating. So you have breakdown and rebuilding. But if galactin-3 doesn't get turned off, then it sets up this chronic inflammation. And one of the things this molecule does, it's a pentagram, so five side. It's got five like a star,
Yeah.
and they start to attach to one another. And when they do, then they start to um, create the environment for biofilm. And you know what biofilm is. So it's like a thing of jello. And when that happens, now these toxins can get inside and you can't get to them because they're all in this goo.
Mm.
Galactin-3 kind of accelerates this process or makes it more likely that it's going to continue to do this. And so Isaac, Dr. Elias, we talk about, okay, what are the things you can do to start to shut off galactin-3 production? And a big part of that is breathing, proper breathing, meditation, getting a good night's sleep, things that I kind of, as I share with him, I find it kind of boring to talk about. But again, it's the foundational things that we all get jaded to. But that's what the best thing you can do to help your body heal itself and stay healthy is to practice these good health hygiene things that we know we need to do, but we sometimes just think, oh yeah, okay.
I know sometimes the simplest things think, well, they can't work, they're too simple, but it really is that simple that we're
Yeah,
sending a message to ourselves that it's
yeah,
safe. It's safe to reproduce and
exactly.
and
Yeah,
and be in an environment and to do all the functions that cells do, because the cells are like mini versions of us, right? They have reproduction, they have respiration, they're producing energy also. It's like they're a little model of a human being.
yeah,
And so if it thinks it's in danger, it's not going to reproduce well.
yeah.
So I mean, it's basic, it's simple, but it's beautifully simple, I think.
It's so simple, but I told both Eric and Isaac, I told them both, I said, these are game changers for me, what you've shared, because working with really complex patients as I have for two decades now, um, you think you've done everything right, and then you have a small subset of folks that are just not getting where they need to get. And it was just those interviews were two aha interviews where I was like, oh, that explains it. We got to go back. Not only are we treating the root causes, okay, low thyroid and carrying around some extra weight, so they got high blood pressure and the blood sugar's off and creating some nerve damage and these kind of things. We got to look at, okay, what's your lifestyle like? Okay, got to clean your diet up. And even though for a lot of patients that I work with, um, diet is really important, but it's the long game. You don't see a lot of symptoms turn around that quick by just changing your diet. And so we're all told, you need to eat, you are what you eat, right? And that's true. Eventually, that's who you become. The fuel you put in your body is how your cells or how healthy your cells become. But that's the long game. It takes time. So that's why I like talking about 5-hydroxytryptophan, 5-HTP, and adrenal cortex, and resveratrol, and liposomal glutathione. I mean, the biochemistry stuff is great, but you can't get to where you want to be and stay there without cleaning up your diet, getting a good night's sleep, practicing stress reduction techniques. I recommend everyone find their hour of power. And that's a time of day where you're going to decompress, quiet time with meditation, prayer, reading positive material, whether that's Joyce Myers, Zig Ziglar, Wayne Dyer, whatever it is that feeds your soul. Journaling, doing affirmations if you're into that, setting goals, laying out what you're going to do that day. But it's so important to have that hour power. Maybe you can't get an hour power in. Maybe it's a half an hour of power. I think it's so important. That sets the stage for the day, the week, the month, your life, making that time and investing that time for yourself.
Ah, you're speaking my language, Roger. I love that as well. And especially mornings is the
Yeah.
time to do it, right? Because it sets up your day, as you said. Okay, I know that you said some words in there that people like might be like, "What's that?" I don't know what L-tryptophan is. So people should really tune into your summit to learn a bit more. And really, it sounds like for everyone, I know everyone is concerned really about COVID and how it might affect them.
Yeah.
We've all got someone who has been
Yeah.
touched by COVID. So there's something really for everybody in this summit. And, we're all breathing, right? We're all breathing, and healthy lungs are foundation of life. So really important topic that you're covering here. And I'm so grateful to you and the work that you're doing. I'm honored to be on the summit, but also I can't wait to tune into some of these other interviews. They sound so interesting. And I know lots of people to learn from there. So we've got a link that we're going to share. But I also want to ask you, I always have this one question. So this podcast is about intentional living and for wellness. So I love talking about baby steps, a tiny step someone could take today. So what would be your advice on one tiny step someone could take today to move them towards better health?
I think finding that time. I think most people are reactive instead of proactive. Most people wake up in the morning and whatever happens that day happens to them. And you can control, a lot of times you can't control your environment. You can't control what happens. You get the letter from the IRS, or you get the phone call in the middle of the day from school from your teenager. I mean, some of these things you can't control. What you can control is how you respond.
Right.
And one of my mentors, Wayne Dyer, said one time that
So good.
when you squeeze an orange, what do you get? You know what you're going to get. You're going to get orange juice every time, right? What happens when you get squeezed? What, what is when you get under stress? What comes out? And that really resonated with me years ago about the only way you can change that is first being aware that you have an opportunity, you have a choice of how you're going to respond. But if you don't even acknowledge that, you're at the mercy of whatever happens that day, that week, that month, that lifetime. And the place to start is that quiet time to get to know yourself. If you don't take time to get to know yourself, you're never going to have the opportunity to control how you react to the stressors that we all experience in life, which stress and inflammation are the two drivers of every unwanted health condition. And so understanding that to me, it puts you in such a proactive state where now you can find 15 minutes, if that's it, a day, a quarter of an hour. And it sets you up for the rest of the day to be able to be the person you want to be.
Mm. So well said. We are gifted as human beings with this ability to be the observers of what we're thinking. But a lot of people aren't really taking the time to notice that, right? So, what you're talking about is creating a little window where you can be that observer, notice what you're thinking, notice what you may want to think, right? Your goals and what you want to experience. So we can plan. That's another gift of being a human being. So we've got these gifts, so let's use them to help make our lives better. So I love what you just said. Thank you so much.
Thank
And
you. Yeah.
so, what is there anything we haven't talked about that you want to make sure the audience hears?
I think, it's kind of broad, and I wish we had gotten into a little more nitty gritty clinical pearls. But the summit's free, so check it out. You have a week of all these presentations. I would encourage you to check out my presentation because it really goes deep into lung health, the physiology, the anatomy, how to reduce inflammation in general, and then some of the drivers that are affecting people in a negative way. But there's so many wonderful your presentation on breathing. I think and I'm sure you've coached people on that, but there's so many good ones. I don't know. Just tune in and find one and see if it resonates with you. Check them out. There's so many good presentations.
Oh, thank you so much. And where can people, we got the link for the summit, but if people want to find out more about you or work with you, how would they find you?
So thanks, Jane. So there's two different websites. One is yourfibrodoctor.com, your fibrodoctor spelled out.com. And that's all about fibromyalgia. I work fibromyalgia, chronic fatigue syndrome. The other website is much more broader for my functional medicine patients who don't have fibro, thank goodness. And that's superhealthyhuman.com.
Oh, I love it. Don't we all want to be super healthy humans?
Absolutely. Yeah.
Rodger, thank you so much for being a guest on Wellness by Design today. I'm so grateful to you, the work that you're doing, and spreading healthy lungs throughout the world. So thanks for being here today.
Thanks, Jane. I really enjoyed it. Thank you.
And thanks to the audience for watching, for listening. And please share this with someone who needs to hear it. If you know someone that's suffering with any lung condition, they need to know about this summit. So please share it with them. And thank you so much for tuning in. We'll see you again later.